Guys, going back to another video. We're going to be looking at the shoulder sling here, and it has an abduction pillow. And what's good about this thing is there are two slings for it. This sling up here goes around your shoulder and neck area, and then this sling down here goes around your waist. So we'll have Dion put this on, and so this will be on for his right arm here. And so he'll slide that sling over his shoulder and his neck there. And then, perfect, making sure that abduction pillow is against his side to slightly abduct his shoulder. The reason we do this is because the supraspinatus, if his arm was closer to his body without this pillow, it'll put more tension and strain on that supraspinatus. So abducting it slightly will relieve that pressure. And that's good for healing. Cool. And then this other strap here goes around his waist. That just offers more support there. Perfect, and that clips in that way. And then one thing you kind of want to look for here for the sling as well is that you want it to be slightly elevated, his distal part slightly elevated there, just because if it was descending, it'll allow a lot of swelling in the hand. So we just want to reduce that to have a slight tilt up. And so everything's looking good here for the sling. One area that you want to check after you get done wearing the sling is you want to check for pressure points on the arm. So we're basically anywhere that this sling is touching his arm, you kind of want to test to make sure there aren't any injuries going on there from rubbing against the material. And how you do that is with a blanch test. And so, for example, here, let's say if he has a little red spot or a pink spot on his hand right here from rubbing against this area, what I'll do is I'll just press on that area and then see how it slightly changed a little bit of color there, where we just want to see it change color. If it doesn't change color, that means that there's an actual injury there. But if it does change color, that means that there's just a little bit of redness there, and we'll talk a little bit about that when we get over to the board. So that's how you do a blanch test. You always want to do this whenever you take off your sling, or if you feel something a little bit irritated, or you see any discoloration like red or pink marks on your arm here. And then to take this off, it would be a real hard time if he undid everything and then tried to put it back on. So I always recommend is you want to unbuckle the waist or like the back support there, and then you will just slide the sling off kind of how he put it back on. If you completely take this top sling off and undo it, then it's going to be nearly impossible to put it back on just by yourself if you have a shoulder injury. Cool. And so moving over to the board here, what we kind of talked about in the video is you want to check for that redness or discoloration wherever that irritation's at on their body, where that skin is in contact with the material. You want to do that blanch test, which is just pushing on that discoloration spot to see if there's a change in color. And so if there's no blanch, that means there's an injury, and you just want to call the clinic and get in to see them as soon as possible to get that taken care of. And then if it is blanchable, meaning you press and there's some discoloration, a little bit lighter color on that area, then there is a little bit of irritation there. So you just want to check the fit of your device or sling or anything like that. And then you want to mention it on your next visit when you're visiting with your PT. And then you always want to educate your patient. If it feels too tight, you also want to test the cap refill. It's basically the same thing as the blanch test, except taking it a step further. So on me here, here's a blanch test. See that discoloration, and then we're going to count anywhere from 3 to 5 seconds. You want to see that blood fill back into that light colored area. And if it's in that 3-second timeline, then you're good there. If it's over 5 seconds, then that means it's too tight and there is reduced circulation in that area. And so that's how you put on a sling and do a skin test.